Oops. Hello and welcome. We'll get started really soon. Great. Hopefully my volume is good. Can someone just type into the chat and let me know that they can hear me? Hopefully. Man.
I want to see if Riley can take.
I'm on. We're live.
Okay. If she can just take notes of who's going to be on. So, because one person runs it in.
Okay.
And I have to help.
Okay, cool. Riley's on the webinar. Cool. We'll get started very shortly. All right. It is exactly 11 o'clock. I hope you guys can hear me. I am going to start right on time today. So thank you so much for being here. If anyone wants to type into the chat, just to know that I'm not speaking to myself. This is a webinar format, so I can't actually see any of you guys. And so maybe just like anything to know that I am being heard. Are we, can you hear me? You guys are all on, so I'm assuming you can hear me okay. Perfect. I will just keep talking then. Okay, I am Dr. Allison Feldt. I own Body Motion Physical Therapy. We are located in downtown Edmonds, Washington, and also in Poulsbo, Washington. Our director of therapy in Poulsbo is Dr. Riley Phelps, and she is also attending this webinar. Maybe I'll allow her to talk here. There is Riley. Riley, you want to say hi?
Hey guys, can you hear me okay?
Yes, we can. Thank you.
Yeah.
All right. This is Dr. Riley. So she is at the Poulsbo Clinic, and yeah, she used to be here in Edmonds and then moved out there, and we opened a location out there. So she does all the pelvic wellness and pelvic floor PT out in Poulsbo. So I am so glad you're here today. We are going to talk all about pelvic floor wellness and truly the importance of why. Let's remove you now. Okay, perfect. Oops. Let's see if that worked. I'm sorry, you guys, just give me a second. Dr. Riley is disabled. Perfect. Thank you so much. Now she's kicked off. I actually just kicked her off. I didn't even know I could do that. So hopefully she'll rejoin here. And I will get this all together. But I'll just finish my intro. Oh, now we have two Allison Feldts on too. So, okay. There we go. Thank you for your patience. Okay, so yeah, so I'm Dr. Allison Feldt, owner of Body Motion, and the reason why pelvic wellness is so important and why I wanted to just bring this awareness to everyone who will listen, essentially it's my passion project, is because it is the essential to our core. So the pelvic floor is part of our core. And core is trendy to say, right? Like everyone knows you need a strong core, but no one actually knows what that even means. And it's so important that we know how to use our core, including our pelvic floors. And that does not mean Kegels whatsoever. So it's really important that we know how to use our pelvic floors, so that we can have strong joints, healthy joints, don't need hip replacements, joint replacements, bladder surgeries as we age. So it's really important that we know what we're even talking about. So today I'm going to go through, we'll talk about what the pelvic floor is. That'll be, let's see, get me to the next slide. Okay, so we'll talk about the essential functions of the pelvic floor. Then we'll talk about actually how to contract, relax, and bulge the pelvic floor. What I'm not going to ever tell you to do is to do Kegels. Kegels are essentially not important in having a strong core ever. And so if you are doing Kegels, you can go ahead and stop them. And most people don't even find success with Kegels actually helping them have a strong pelvic floor. And so we will talk how to control your pelvic floor. And then I'm going to teach you some tools on exactly how to start utilizing your pelvic floor so it is the healthiest muscle possible for you. And that'll include some funny things like how to poop, how to pee, all that good stuff. So we'll talk about all that stuff, and it's stuff you can teach your kids, you teach your family members, because it's stuff that everybody needs to know how to do safely and appropriately so they don't hurt this part of their core. So and then we'll talk about some ways that you can start utilizing your core in your workouts too. And what that looks like and should look like. And then we'll talk about what pelvic floor dysfunction looks like and when to seek help. And truly, I'm a firm believer that everyone should have some pelvic wellness checkups, especially if you've had kids. Really, like the pelvic floor is affected in so many parts of our lives, and it should be checked even if you want kids. I mean, a lot of people have pelvic floor issues, or it's not the most perfect muscle that we think it is. Even if you exercise 6 days a week and go to Pilates and do all the things that you think you're supposed to do, and you think your core is really strong, though that's often the time like where we need to learn how to undo our core, learn how to relax our core. And a really tight muscle does not mean it's strong at all. It means that it's not working in its full range of motion. So it can't be that strong. That's where we see a lot of incontinence work come up. So like incontinence means peeing your pants, right? Or leaking when you don't want to be peeing. So a lot of people will describe that as an issue. So we'll get into that. We'll talk about how to protect your bladder so it can stay inside your body, and so you're not leaking as you go through life. This will be really fun if you want to ask questions as we go through. So the more interactive, the better. And I won't say your name if you ask a question, because this is being recorded and we'll send it out to people that couldn't make it. But I will just answer your questions. And so feel free to send them to me anonymously, and I'm happy to answer them. I think you can do that. And at the end of this, when we're done talking, you can also sign up for a complimentary consultation where you can sit down with one of our providers and really talk through your specific body and how to be the strongest that you can be. So we're talking all wellness, and what it looks like to be the healthiest version of yourself, because isn't that what we're all striving for? Yesterday, I was just I was thinking so much, because I have some patients that are in their 60s and 70s, and they have had some surgeries or they've had some issues, and they're so frustrated that they didn't have this kind of care when they were pregnant, or when they were postpartum. And so their bodies ended up having severe compensations that led them to hip replacements, led them to a spinal fusion. And it's sad to me. And that's why I am blurting this out from the rooftops. Everyone should have their pelvic floor checked out. You should at least know how to work your pelvic floor. And that's what we're going to be talking about today, so you can protect your joints. Really, for many reasons. So I just wrote this in here. So what happens when you start a new fitness routine and activity? Our body adjusts to that activity, right? And so does our pelvic floor, so does our core. And hopefully it's being used in the right way. But if it's not, a lot of times we develop compensation patterns. And this might mean that you've always had these compensation patterns, and now you're working them harder, and the body eventually gives in. And so when the body gives into these compensation patterns, you end up with things like low back pain. A lot of people have like right SI pain, especially after kids. Or, sciatica, right? And then they have to stop their new fitness routine. Or you might start your new fitness routine and it involves jumping and you can't jump because you pee your pants. Well, that means that like some portion of your core isn't working. But in our society, we usually just give medications for that. And then we usually just tell people to get surgery for that. So that's kind of the standard of practice. But what that means is that we're just covering up the issue. We're not treating the core and making sure that your core is rock solid to protect your body. So essentially, I'm going back to the pelvic floor, right? So the pelvic floor is the bottom of the core. So I'm going to show you the pelvis here. So here's pelvis. It's the very bottom of the core. It makes up like 1/3 of your core function. Then you have your abdominal wall, okay? Then you have your diaphragm, which is on the top. So when you take a deep breath, you're using your diaphragm, and that's the top of the core. And then you have these back muscles in your buttocks, okay? And that's the back of the core. So all of this makes up the core. The pelvic floor is very internal. It's taboo to talk about essentially, and we don't really discuss any of the issues that are within our underpants, essentially, right? So the pelvic floor, it has the urethra, which is where we pee. It has the anus, which is where we poop. And then it has vagina, which is where we birth babies and or have penetrative intercourse or whatever you do. Okay. So so those are the three parts. There's a different doctor for every single part of these holes. And that's kind of a bummer because then people end up with an issue but might also have an issue in another area and it's not tied together. And that's where like a pelvic expert PT or someone who really specializes in the pelvic floor can really tie a lot of the symptoms together as well. But that's a side note. So those are the functions. Then we have clitoris too, and that's for pleasure. It's super important. So these are all part of the pelvic floor. So any issues with any of those things, peeing, pooping, farting, queefing, sex, having orgasms, all of that is controlled by the pelvic floor, or at least partly controlled by the pelvic floor. And so it's really important that these muscles for those functions stay really, really, really healthy. And so there we go. I kind of brought this up a little bit earlier. But the reason why I feel so strongly about teaching pelvic floor therapy and like really just talking about the pelvic floor and how it works for people so they know how to utilize these muscles is because I used to work in outpatient physical therapy when I started as a PT. I was still working in the pelvic floor from the very beginning. But I would see these women in their 50s and 40s, really 40s, 50s, and 60s. And then by the time they're in their like 50s, they've kind of like maxed out their cortisone injections. They've maxed out that kind of stuff. Then they start to contemplate the joint replacements in their 60s. And I was like, why is this was so common. I saw it was nonstop. And then of course I have like my mom who like I am seeing age, right? And like she had her, her mom and my dad has his mom and like I've seen their issues, right? And I see my aunt's issues and you just kind of like see everybody's issues around you. And meanwhile, they're all like, they're going to like regular physical therapy. I was doing regular physical therapy for like their hips and their backs, right? And try and help them prevent the joint replacement. But it's like at that point, like you're only treating the hip or the back when so much of all of these women's issues, that women have way more joint replacements in the US than men. Why all of these issues are happening at so many of them is because they're wearing out their joints way faster because essentially once they have kids, they stop using their core. Okay. And it's not like to a fault of them. It's not that they don't want to use their core. They might be trying, they might be doing sit-ups and all these core workouts. But the issue is these muscles can't function properly if they had tears, if there was scar tissue. So like vaginal birth tears, right? So like tears within the actual perineum itself. So this is called the perineum. So, the vagina can tear when you have a baby, and scar tissue within the belly. If you had a belly birth, okay. You can have scar tissue anywhere. Well, when you have scar tissue, it is almost impossible to really try and retrain those muscles unless you know what you're actually trying to retrain. And so I won't go into further to that, but like it creates so much issue in how these muscles and how the core coordinates. what we also end up seeing is like, when I do evaluate anyone postpartum or like see someone after they had a baby, this could be 5 years, 10 years, 20 years, and they have no symptoms. They're just coming because they heard it was good for them. And we end up seeing like everyone who's ever had kids, a lot of times even before children, have pelvic organ prolapses. So that is where your organs start to descend out of your body. Okay. So your bladder starts to come down, your uterus starts to come down, or your rectum starts to come down. And the goal is to keep those inside of our body, right? Like that helps us from peeing our pants. That helps us from feeling something between our labia that is uncomfortable and maybe chafing, and all of that stuff. So we want to keep these inside of our body. And I truly believe that, like, if we are taught how to keep these organs inside of our bodies, we won't end up with these needless hysterectomies and peeing our pants, just like you see almost every single person in any assisted living facility having these issues. I mean, this is like the cascade when you die, right? Like your grandma's probably peed their pants. And I'm sorry to say that. And hopefully your grandmas are still alive and everything and healthy. But like really what we see is the people in the nursing facilities, they end up having those issues where they are peeing their pants, end up with joint replacements, or have had a previous joint replacements, are in wheelchairs, and it's kind of this cascade. So it's really important that we learn how to keep these organs inside of our bodies. And that's what I'm going to teach you today. And you might have signed up because you want to have a healthy and strong core, and keeping these organs inside your body is having a healthy and strong core and will allow you to use the bottom of your core so much better, which is your pelvic floor. Cool. Is that all making sense? I can't see any faces whatsoever. So please type into the chat. And that would be great. Maybe. And you don't have to type into the chat if you have questions, anything. Cool. I'm going to keep going here. Okay, so we just reviewed the pelvic floor, went through the anatomy. It's 3 layers. So there's a lot of muscle there. It's not just one muscle. There's also fascia and ligaments and all that good tissue. And again, it helps keep your organs in. So if we're looking at the core, if you look at this picture to me, it's my upper right-hand side. I don't know what side it is for you, but for me, it's upper right-hand side. You can see the diaphragm, abdominal wall, and pelvic floor. That is really the canister that we're talking about when we're talking about having a healthy, strong core. And so we're going to teach these muscles how to work. So here's a soda pop can. A really strong core has super good pressure, which the pelvic floor would be the bottom, abdominal wall would be the front, the diaphragm is the top, and then you have some back muscles. When you lose your pressure, have scar tissue, just are stressed out and walk around with a really tight pelvic floor, which is what most people walk around with, what we see clinically at least. When you walk around with a really tight pelvic floor due to stress, due to lifestyle, whatever it is, not knowing how to relax your pelvic floor or get in touch with these muscles, you end up having more intra-abdominal pressure. So you're more susceptible to like blowing a disc out. But the idea is that we want the pelvic floor to be in a good, relaxed state so you can maintain this solid pressure within the can. Okay, so pretending our core is the can, if we lose pressure in any of these muscles and we pop the soda pop can, we can easily squish the can. So we have to train these muscles to be rock solid. And that does not mean Kegels, right? Because if everyone's walking around tight, Kegels wouldn't help the situation. And so we have to train the soda pop can how to absorb the forces. Okay. So it's easy to squish this can when there's holes in it, when there's scar tissue, when these muscles aren't functioning. And I hope that makes sense. Cool. So I'm going to keep going here. So our very first thing we're going to talk about is, I mentioned this briefly, but one of the reasons that people have such tight pelvic floors is because the pelvic floor isn't just innervated by it's also innervated by our somatic nervous system, which means that like emotional states can affect the pelvic floor. So it makes it harder for us to relax our pelvic floor. So if you do live a stressful life or you don't take time to kind of unwind and relax, then your pelvic floor might end up just kind of constantly staying tight. And this is truly, truly what we see even after babies. Your body is amazing at compensating. So most people come and they think like they just had a baby and they've like blown out their whole vagina and essentially think that they have like no muscles, are super weak. And it's the complete opposite. It's the opposite because your body's like, yeah, everything's heavy. I better squeeze to hold it in. And so you just naturally develop this compensation of tightness and tension within the pelvic floor of your organs your pelvic floor trying to hold your organs. The issue is then people start doing Kegels or different core workouts that contract the pelvic floor. Meanwhile, their organs are below the pelvic floor. So when they Kegel, they're actually like squeezing their organs out further and further. This is why we don't suggest Kegels, because it can make things way, way worse. And so it's really important to learn how to relax. So the very first thing we're going to do together is to learn how to relax our pelvic floor. Okay. So I'm going to have you tune into your body. Is everyone with me? We're good. We're learning how to relax our pelvic floors. Cool. Okay. So I want you to sit. If you're sitting on like a harder chair, it might be easier to feel. If you're sitting on the ground, you might feel this too. So anything kind of hard to give you a little sensation. You're at home, no one's on video here. You could also stick a finger right inside, like right between labia or right on your perineum and see if you can sense this. So what we're going to do is we're going to take a breath together and we're going to see how it affects our pelvic floor. So if you take a deep breath in and then you exhale, what is happening here is that the diaphragm under your ribs, when you inhale, is moving down, filling up the abdominal wall, filling up kind of all around, right? Bringing the air in, lungs are expanding and everything's going down. We want your pelvic floor to mimic that same movement and open and go down without you straining or pushing it down. Okay, so that's step number one. So I like to do this. There's a lot of ways to breathe out there. You might be hearing different things. You might be going to physical therapy and they're telling you to breathe a completely different way. There's lateral costal breathing, which is more breathing into the rib cage. And then we're talking specifically about diaphragmatic breathing. And this is how to help open pelvic floor. So if you connect down right now to your anus, a lot of people have better connection to anus, but you can also try connecting to vagina. It's all connected within the same muscles. So you can just connect to where you feel it the most. You can do a little squeeze just to feel it squeeze. You should feel your pelvic floor lift off the floor, lift off the chair you're sitting in, just kind of close and lift up. Okay. And then you should be able to feel it let go. What we want to happen is we want you to be able to feel it let go without actually squeezing, because that would be a Kegel. So we want it to be able to let go without squeezing. So how I do this is a diaphragmatic breath. I like to put a hand on my chest and a hand on my belly so I can really focus on driving the air deeply into my belly and kind of into my ribs and like imagining I have an umbrella and just pulling the air all the way in. So deep breath in. Think about opening, exhale and let it go. So what we want to happen right now is you're going to connect to anus. I have to do it with you. So I close my eyes to connect a little better and be a little bit more present in my body. You're going to take a deep breath in. Think about flaring your anus open or opening vagina as you inhale. As you exhale, let it go. Let the pelvic floor recoil. You might feel it contract, but it's really just a passive recoil. It should mimic exactly what's happening with your diaphragm. Then inhale, feel it open again, pulling the air all the way down into anus, all the way down into vagina. Everything is opening. And then exhale, let there be recoil. Okay, so if your vagina was a rosebud, we want your rosebud to blossom into a flower and see all the petals of the rose when you inhale. Okay. So if you take a nice deep breath in, you can use that imagery. Think about turning that rosebud into an actual rose. And if this is hard and challenging, it is, especially like with how we walk around holding our pelvic floors. Another thing to like start to tune in to relaxing your pelvic floor. And it's more of like a daily habit. But so many of us walk around, and I see this just constantly with our, I don't know if you can see my booty here, but with our butts just so clenched. And when we clench our butts, that is going to cause the pelvic floor to constantly be elevated. So you want to practice unclenching your glutes, unclenching your butt in order for the pelvic floor to also be able to relax. So if you know you're a butt clencher, you might like now take a couple days and like find yourself butt clenching, let that go. Not only is that going to help your pelvic floor, it's going to help your low back a lot. And so play with that, try and unclench your butt and then that will help pelvic floor be able to open. If you feel like, what is this lady talking about? I cannot feel my pelvic floor open. That would be a really good time for you to come see us, come see a pelvic expert PT, get an internal exam of these muscles. Even if you can sense it, get an internal exam of these muscles. If you feel comfortable yourself, you can insert a finger into your own vagina and start to feel some of these muscles. Can you feel it open and let go? If it's painful at all, or even if there's just so much tension and you don't know what you're feeling and you can't really feel it open, get a pelvic exam just so you can, and not by an OB, they're not going to check all these muscles. When we go through an exam, we're checking all 3 layers, and we do one side at a time, and we just go through every single muscle, the borders of every single muscle, and we treat these muscles as we go, and we help give them new length and open them up. When you open up a muscle, it gives it so much more strength. It just gives it this power and efficiency. So like I squatted this morning and I deadlifted. And I had to make sure before I did that, my pelvic floor was fully relaxed. And I'm going to show you some pre-workout things I do in order to help shift my organs up and make sure my pelvic floor can relax in order to like be the most effective and force absorbing when I'm doing these kind of lifts. So I'll share that with you too, but hopefully you're kind of getting the idea that like really truly all of your power lies within relaxing your pelvic floor and opening your pelvic floor. So even if you leak, so like if you leak urine at all, and you have like stress incontinence, you can't jump on a trampoline with your kids, you can't run without peeing, or even if you just sneeze and you leak a little bit, that's all like incontinence. And it might not be due to the fact that like you just don't have the strength. It's 99% of the time due to the fact that it's hard to open and like your body isn't in this resting tone. So when your body needs to sneeze and hold things in, it can't because it's already here. And so it's sneezing into a really hard wall. That was an aggressive sneeze, but hopefully you get the point. Yeah. Any questions about that? I'm going to keep going here. So breathing, I say do breathing 5 minutes a day and then do it before your workouts. Try and like work this in. If you don't work out or you just like to walk, or if you are just working on life right now and you have to carry your kids or whatever it is, before you do anything strenuous, work on relaxing. Take 5 deep breaths. I really say it's important to have 5 minutes of this deep pelvic floor opening a day. It's a great way to relax your body, but it's also just really healthy for your core. Okay, so now we're going to go into some fun things. Yay, some questions. Woohoo. The chat is disabled, so no one's chatting. Oh no, how do I enable a chat? How? I see questions. Are you able to enable the chat? Thank you for waiting, everyone. We will enable this chat if I can. Show chat previews. I don't know what that is. I don't know how. I guess probably, oh man. At the bottom of the screen. No, it's not at the bottom of my screen. Mine's at the top. Remote control. Okay, sorry guys. It'll have to just be in questions. I'm really sorry about that. If in pregnancy, can it be helpful to do a Kegel before you sneeze? Yeah, there are times that it can be. And so, but as long as your pelvic floor is relaxed before, it's obviously a hard thing to time, but especially in pregnancy, your pelvic floor gets so tight trying to hold the body together. And so if you're going to sneeze during pregnancy, like, yes, you are going to have some Kegel going, and you want to train your body that's what happens. You do have a contraction before you sneeze. But if you aren't coming from a relaxed point, contracting might actually make it worse. So a couple things. If you're in private, obviously you're not going to just do this walking down the street, is you can put your hand right on your vulva and give it some pressure. That can help as you go to sneeze, crossing your legs, some of the standards to help like hold things in, that can help. And I know it sounds contradicting, but taking a nice deep breath and relaxing pelvic floor before you sneeze will allow you to contract and hold it more right when that sneeze comes. With coughing and sneezing, the pelvic floor, you want to consciously, and you want this to happen so unconsciously, but you have to start training it when you're more conscious of it, is you want to be able to squeeze and hold your organs in when you go to like sneeze or cough and have any powerful, movement that way. But most of the time people don't do it effectively because they're already so contracted, they can't squeeze further. So their organs are just like getting squeezed below the line of the pelvic floor. And so when they go to squeeze, they're just leaking more and more. So try it both ways, and see what you think. Cool. Awesome. Great. Oh, I love that you're doing the birth prep class. Good. Yes, we have an online birth prep class for anyone that's pregnant. And it's really about like how to control your body, how to control your pelvic floor, and prepare for the best possible vaginal birth that you can, or a planned C-section. Okay, so we're going to go through these different tools, and it's really important that you start practicing these, because this is going to save your pelvic floor. This is going to save your pelvic floor tenfold. If you just do these things and you're like, I don't want to go to pelvic floor therapy, I don't want anyone to ever tell me what's happening down there, then at least do these, okay? Because it will help you. It will help with hemorrhoids. It will help with long time, incontinence as you get older. It will help with so much. So we're going to go through how to poop, and then we're going to go through how to pee. We'll go through how to engage your core, and we're going to go through how to squat, because you can squat for lifting purposes, weightlifting, or you can squat just to pick up your child. So I'm going to go through both of these. Okay, first, let's start with how to poop. I'm just going to check the questions really quick. So can you address hemorrhoids, internal versus external, in relation to pelvic floor? Okay, so someone's asking about hemorrhoids, and hemorrhoids is a vascular issue. So, right, it's happening in the blood vessels. Essentially, to heal hemorrhoids, we want them to turn into skin tags. And if they look like little skin tags around the anus, that's great. Those would be external hemorrhoids. Internal hemorrhoids, you don't actually feel. So you would only know you have those if you have like blood in your stool. And so you can only feel external hemorrhoids, but, and they're obviously common, and not most people, they can be developed during pregnancy, especially if your pelvic floor is tighter. So the tighter your pelvic floor, the more pressure there's going to be on your blood vessels. So the more likelihood that you'll have to have hemorrhoids. And so the idea is that like the more you can relax your pelvic floor and not strain, the less pressure there's going to be on the blood vessels and the hemorrhoids themselves. I hope that answered that question. Cool. Thank you for asking it. Okay, how to poop. So we're going to use our diaphragmatic breath that we just learned, and we're going to put that into pooping. Okay, so that's what we're going to use. So when we first go to poop, the position that we want to poop in is going to be in this flexed, bent over position, almost allowing our back to kind of curve a little bit. When we do that, what that does is it straightens the chute for which you poop. Okay, it's called the anorectal angle, but it just straightens the chute. So it makes it so you can just like breathe your poop out. And that is the goal. So if you have a squatty potty, that would be the most ideal, to have your knees up so you can kind of attain that position that way. Some people, if you're pregnant or you have more belly space, then that might be a little bit more uncomfortable for your body. And so that's where you can just go into the leaning forward, spread your legs out as far as you need to in order to attain that. So you get into this position, and then what you do is you do 3 nice diaphragmatic belly breaths. Okay, so we're pulling the air into our belly and then letting it go. Thinking about opening the anus on the inhale Inhale and open, exhale, let it recoil. At the top of the third inhale, you're holding the air and then you're gently initiating what would be like a little bear down. So it's like a fart when you don't want anyone to see you fart. It's like so little. It's not like pushing and straining. It is just a fart. Like gentle, letting out some air. And the idea is that your stool consistency is good. And we can always help you with that if it's not. And so the idea is that your stool consistency is good, that you can just breathe your poop out without having to strain. So teach your kids this, teach your husbands this. This is really important in helping the stool just get through the body without having to strain. So 3 diaphragmatic breaths. On the third one, hold the air and bear down. Okay. Like you're trying to fart, but you don't want anyone to see you fart. And it's super, super easy, and it should feel easy. What the diaphragm is doing when you inhale, the diaphragm is dropping into your belly, just like we talked about, allowing the pelvic floor to relax, but also it's pushing on your colon, which is increasing the peristalsis, which is helping the poop just kind of shift more through your belly. Okay. If this was like the colon and that's the poop, that's what's happening. So the more you breathe deep like that, the more you're going to stimulate that peristalsis, which is good, right? Like we all want to poop more. We all want, unless you poop your pants, but that, we can help with that too. But the more you poop, the awesome, right? It feels good. You're unloaded. It allows your core to be able to contract more. For exercise, I like to say, like, try to have a bowel movement before exercise, because that allows less pressure down on the pelvic floor for when you're doing your exercises. I think I'm caught up on the chat or on the questions. Sorry, I'm a little funny with this. Okay. And then, so that's how to poop. Does anyone have any questions on that? Please feel free to drop them in the Q&A. We got another question regarding the hemorrhoids versus anal prolapse, and anal prolapses are not very common at all. So that would be called like a rectal prolapse, not a rectocele. So a rectocele is when the rectum's coming into vagina. A rectal prolapse is just when the actual sigmoid colon and rectum start to descend through the anus. That's really just, it's not as common, but definitely get it checked out because it can happen. Both my daughters were actually born with rectal prolapses, which probably a lot more kids are. I just probably noticed it because I'm a pelvic floor PT. And it's resolved over time. So anal prolapses, rectal prolapses are just not as common. If there's a lot of anal sex happening, that increases the likelihood of an anal prolapse or rectal prolapse, just because it's kind of opening the sphincter constantly. But yes, that's all I'll say about that. Hopefully that answers that question. So we'll go back to how to pee. Okay, so peeing. So maybe you've heard this, maybe you haven't. First off, you should never go just in case. Going just in case teaches the bladder to empty urine when it's not fully full. So you want to make sure that you go every 3 to 4 hours is a healthy time to void. And, and even if you're drinking a gallon of water a day, your bladder adjusts to what your intake is, just like your body adjusts to what your intake is. And really, you should be able to hold within that 2 to 4 hour range. And that would be healthy voiding schedule. If you're going more frequently than that, going every hour, or not going enough and only going every 6 to 8 hours, you want to train your body to really be in that 3 to 4 hour window. That's going to help decrease the acidity of the bladder, which is if the bladder is really acidic, what happens is it contracts more, which causes more incontinence. And so drink your water. It's good for you, and it's not going to make your incontinence worse. Okay. So every 3 to 4 hours, go pee. So when you sit on the toilet, sit fully on the toilet so your pelvic floor can get into that relaxed state. So you'll do a couple breaths into pelvic floor. And then when you finish peeing, and you can pee in whatever position you feel like you can get the most out. You don't want to be straining at all when you pee. But then once you're done peeing, you want to take your body and kind of shift back and forth. This is especially true if you dribble on the toilet seat after you pee. Usually that indicates that you have some degree of pelvic organ prolapse. And it's no big deal. I have a pelvic organ prolapse, and it helps me keep my pelvic floor healthy. And like I said, most people we evaluate have some degree of pelvic floor prolapse. So I don't know what just happened on my screen, so sorry about that. And so done peeing, just shake out. I call it shake out. And then you can go side to side too, and that will help prevent that dribble afterwards. And so that also just makes sure you're fully empty and nothing's residual. So if things are residual left in the bladder, you're more susceptible to infection, more susceptible to that acidity that makes you feel like you have to go to the bathroom all the time. This is all stuff we can help with as well if you have like issues with any of that stuff. Leakage, having to go all the time, feel like you always have to be by a toilet. That's no way to live. It means a part of your core is not functioning. It means that you should get some help for that. So let's talk about how to engage your core and when. So like I said, you want your pelvic floor to be able to be in this resting state. So this open, nice resting state. So what happens is when your foot hits the ground, you have this reaction through your whole body that your core just automatically contracts, and then it relaxes, contracts and relaxes. It's like the slinky. It's a force absorber. Okay. And that's how the core works. And so we want that dynamic movement. That's why it's really important that you start to feel this relaxation, because people are so bound up and so tight. So feel this relaxation into pelvic floor. The other stretch that I should mention that is really an awesome stretch for the pelvic floor is happy baby stretch. So it's a yoga stretch. It's not safe for everybody, especially if you have diastasis or any separation of the abdominals, but that's a great stretch. I'm not going to get into happy baby now because it's not the prettiest to show you, but a reverse happy baby, you could just do like a deep squat if that feels okay on your body. Put your hands inside on the floor. And if that feels okay, you could do some deep breathing here, pulling the air in there. So that would be another great stretch to help open up hips, but also open up pelvic floor. Okay, so now we're getting into how to engage core and when. So again, we want it to be a good, we want it to engage naturally, and a lot of times it will if it's just if it's relaxed enough. But the other thing that you want to learn how to do is to engage your transverse abdominis muscle. So this is a muscle that sits from hip bone to hip bone, and it's a really deep muscle, and it's an important part of the front of your core. There's also this beautiful ligament that attaches from your belly button to your bladder, that when you activate this muscle, it lifts your bladder up. You might feel your pelvic floor contract when you do this, and I would challenge you that you want to maybe try to keep your pelvic floor relaxed and get this muscle so strong that you can just contract this muscle. There's always going to be some teeny bit of overflow, but the more that you can isolate this, the better. And so if you're looking from a side view, when I go to contract this muscle, if I let my belly hang out, it's like that. But if I pretend like I'm tightening a belt, or if I'm lifting from my pubic bone up to my belly button, I'm here and I'm contracting and pulling up and in. So it flattens your belly, and you can just start contracting this muscle and hold it for 10 seconds, let it go. Hold it 10 seconds, let it go. It's a great exercise as a warm up for your workouts. I do it honestly when I'm falling asleep at night. So I'll do my tightening, this tummy tightening. So transverse abdominis activation, 10-second hold, let it go, 10-second hold, let it go. And I'll do that 10 times. And then I do my 5 minutes of breathing. And then it just helps my core, right? Like I'm contracting, and now I'm going into this relaxation for my pelvic floor, because you will probably get some, unless you have really good control, some overflow to pelvic floor when you activate that muscle. So that's the muscle that you want to be strong. You shouldn't feel like you have to contract the whole time that you're like running or the whole time you're working out. Again, this is dynamic. But now let's bring it into a functional movement like a squat, okay? So if you're squatting, let's just go easy. Let's think about like pulling something off the floor. So bending over and getting something off the floor. you want to engage that muscle. So engage that TA muscle, pulling pubic bone up to navel without squeezing your butt cheeks. And if you can do that and pull something off the floor, the move that you want to do is to exhale as you lift something up, because that will help, that's going to help decrease the pressure off the bladder. So I am going to just tell you that, like, you maybe have heard differently. A lot of like fitness accounts on social media, and I don't know, like, it's very trendy, right? To, if you're going to lift heavy weights, you do this breath pattern and it makes your core so strong, but not if you have pelvic floor issues, or if you're a woman for that matter. I always am like typing like caveat, like, no, this is really stressful on your pelvic floor. So we call it blow before you go. So you can inhale on the way down as you squat. TA is engaged. As you lift up, you exhale. I like to use an SH sound. So a sh sound. I feel more of an activation when I do a sh sound, and that helps lift your pelvic organs up and outside of your body. So any workouts you're doing, that's your move. So if you go to bar or you go to Pilates, and any time it's the strenuous exertion. So I'm going down into the eccentric motion. It's okay. I'm breathing in, core is activated, but I come up into the concentric motion. Then I'm contracting, and I'm not contracting I'm not Kegling. I'm just driving my breath outside of my body. So then my core seizes this direction, helps pull the organs up out of my pelvic floor. So then I'm not pushing things down. This is also really important if you have low back issues or any history of herniated discs. You would want to make sure that you are breathing in that pattern. So any questions around that? Around squats? I'm going to answer just a question that came in when I was chatting. Are we able to be assessed for internal hemorrhoids at a pelvic floor visit, or do you not recommend a different doctor? Yeah, a colorectal doctor. I've had the bleeding you're talking about, increase in pregnancy and smearing of poop, even after hours after a BM. Yeah, most likely that's internal hemorrhoids. You could just talk to your OB about it, or your midwife, or whoever your provider is for your pregnancy. It's not, usually they will wait 12 months after you deliver to really think that anything is permanent and to deal with it. Essentially, it doesn't mean it's not important. So definitely talk to your provider about it. It's not something that the pelvic floor physical therapist will really truly be able to determine. We can see external hemorrhoids. We cannot feel internal hemorrhoids, and you can't feel them either. So truly it's just if you're noticing this blood after you poop, or blood in your poop. And so, or on the outside of your poop. So, talk to your OB or midwife, but most cases they're going to tell you, yeah, that's really common, and we're not going to send you to a colorectal doctor. So that would be the doctor you see. A colorectal surgeon or colorectal doctor, that wouldn't be till really after 12 months postpartum. So I had same thing, internal hemorrhoids during my third pregnancy. Even though it was the pregnancy, I did the most pelvic floor work. But I think my body was like, yeah, you've done this 3 times now. And so, and it didn't come on for me until postpartum, and maybe a little diet related as well for me. And same thing, they went away at 6 months for me. So that's just a little anecdote, but the more that you can keep your pelvic floor relaxed, the less stress it will be on the vasculature. So it won't have to happen every time you poop and all that stuff. Hopefully that answered the question. Cool. Okay. Okay. So we just talked about having a healthy bowel movement. Please let me know if you have questions. So we talked about having a healthy bladder as well, and how to pee. I want to just preface that when you get an urge to pee, you don't have to pee right away. When you get an urge to pee, it's healthy and okay to be able to delay that urge without leaking for 15-30 minutes. Okay. So as long as you're within that 3 to 4 hour range, it's not really a big deal. Delaying your urge to pee is a healthy function of the pelvic floor. You should be able to delay your urges. If you get an urge to have a bowel movement, you should go have your bowel movement right away. You don't want to delay an urge to have a bowel movement, because then that urge can go away. And we want the colon to be able, so when the colon gets an urge, it's stretched out, right? It's full of stool. And that there's a reflux that starts to go away if you don't listen to it. And so then constipation can develop, and you can be pretty impacted and have a lot of stool in your body without not really even knowing it. So when you get an urge to poop, always listen to it, always go poop. Teach your kids the same exact thing. Even when they're at school, teach them that everybody poops. It's okay. Go poop at school. You have to, all that stuff. All right. We talked about blow as you go. So anything you do strenuous, start to do that type of breath pattern where you engage your TA, engage your core, and exhale the air. So you really can develop this strong pop can. I cannot reiterate this enough. And it's just so important as you go into your exercise routines and everything. This is what will keep your pelvic floor healthy. This is what will keep your core healthy. And yeah, cool. So we'll talk about what pelvic floor dysfunction looks like and when to seek help. But I want to go through just a couple things that you can do before your workouts that can help shift your organs up into your body. And you might be like, I don't have a pelvic organ prolapse. I don't have anything you're talking about. This is still just a healthy reset to try and relax pelvic floor. So it is the most powerful it can be for you. And so your pelvic organs are up and out of your body. Men have their organs outside of their body, so they don't have to deal with this kind of stuff. And for women, they have enlarged prostates as they age, so they can deal with that as they age. But for us, pretty much everyone has to keep their organs in their body. It's kind of like a goal of living, right? It's uncomfortable when our organs are outside of our body. They shouldn't be, they don't live there. And so you want to train, you want to keep these inside your body. So I'll get on the floor here. I'm just going to demonstrate what I do, before a run or before a walk, is to help shift the pelvic organs up into my body. I'll do a couple bridges. So I'll come up, pushing my knees away from my body at a 45-degree angle. So I know my glutes engage. And then I just take my hands under my belly, right above my bone, my pubic bone. And I just lift up gently, pulling my bladder up. Totally okay to do if you have a normal pregnancy as well. So just lifting up the belly, kind of taking some pressure off of the bladder, coming back down. I'm pulling the bladder up into my body. Okay. And maybe if you're at the top, maybe it feels good to kind of shake your organs up into your body. And then you come down, take just a couple deep breaths. Think about opening, let it go. Inhale and open. So really easy, can all happen within just a couple seconds. You don't have to sit there and do it forever. It's just a nice thing to do before, if you're going to lift, before you're going to do bar, before you do Pilates, just make sure your organs are pulled up in your body, make sure your pelvic floor is relaxed so you can be powerful. These are just some things that if you are having them, you maybe have gone to physical therapy, maybe even pelvic floor physical therapists. We see a lot of people that have gone to pelvic floor PT and it didn't work for them, and they are willing to give it a second shot. Not all pelvic floor therapy is created equal. A lot of people don't do, intense internal work to help stretch the pelvic floor. If our muscles have been really tight for a really long time, just relaxing isn't enough. We have to work on overstretching and getting these muscles super stretched out so then they have the power when we ask them to have the power to be part of our core. That's a big part of what we do, and what not a lot of other people we see do. There are some, but that's kind of what makes us different, if you will, is really working on this wellness, making sure you have this range of motion in your pelvis. It's not just about what's happening inside your pelvis. It's what's happening in your belly, what's happening in your glutes, what's happening in your back. It's all connected. I'm speaking to the pelvic floor. We treat that whole canister, what you saw, this whole pop can, but it's just really essential that the pelvic floor is also treated and not neglected. And that when you're treating your low back pain, you're not just doing contraction, and you have to address the pelvic floor, else you're not treating the whole picture of the core. So hopefully that makes sense. But okay, so you can read here for yourself, but any like low back pain, sciatica, diastasis, pain with sex, not able to orgasm, constipation, any of this stuff is oftentimes a pelvic floor issue. Knee pain. So if your core is not absorbing the forces and your joints start to take all of this up. And so a lot of times knee pain, yeah, like we get you out of your knee pain first, but if we don't treat your core, you're going to have knee pain that's going to turn into the joint replacement. So it's just really important that this is all connected, right? And that we have some sense of what our core is and how to have the most powerful pelvic floor. So yes, like you see, root cause of a lot of these issues is the pelvic floor. This is a little checklist that you can take for yourself. Maybe screenshot this, and maybe that will be helpful for you. But essentially, you want to make sure that you're not leaking when you sneeze, cough, or jump. You can hold urine for 3 to 4 hours. You can, you have a bowel movement about every day. You can enjoy sex. You can have good orgasms. You can relax, contract, and bulge these muscles. You can engage your lower abdominals. You can make sure you can empty your bladder and your bowels, that you're not leaking stool or leaking farts or queefing. We have a lot of people that come because they queef and they can't get, and that's embarrassing when they go to yoga class and so like that's something we can help with. Usually that's indicative of having some descent of the organ. So some degree of pelvic organ prolapse. Like I said, this is way more common than anyone gives it credit to be. The research ranges from like 54% to 80%. But to me, it's like way higher than this. I was diagnosed with a prolapse before I even had kids, probably from my days of weightlifting and being taught to hold my breath to tighten my core. I did really heavy powerlifting, and that is how the boys trained. And I trained with the boys, and no one talked about pelvic floor. So that is my gift that keeps on giving, is my pelvic organ prolapse. But now I'm here to teach all of you how to be able to manage yours. So yes, that's all I have for today. Like I said before, you can have a consultation with us if you want to talk about yourself specifically. We'd love to hear your story. We have this set, we do the free consultation. So you can have all your questions answered and see if you're in the right space to start healing this today. So I hope that was helpful. Please drop in if you have any questions. Again, just some things that you really want to start to add into your routine is the breathing, the pelvic floor opening, and honestly, the squatting, blowing before you go, making sure you know how to engage those lower abdominals, which is your transverse abdominis. Just going to be really helpful for your pelvic floor. Make sure you're not clenching your butt, and start changing the way you pee and poop. So hope that was helpful. Please reach out if you have questions. I love talking about this. This is my passion. I will talk about it all day long. So thank you so much. Let's see if there's any other questions that I'm missing. Great. All right. Well, that is everything. We will send this out in a replay if you want to rewatch the replay, if you want your friends to see it, your kids to see it, whatever it may be. Please share this information with the world. Take care.